Martinho, specialist obstetrician and gynaecologist, practicing at Botshilu Private Hospital here in Soshanguve, Pretoria. Today we are going to talk about carcinoma of the cervix, commonly known as CS cervix or cancer of the cervix. Cancer of the cervix is an abnormal growth of the mass from the cervix, which has the capability to expand through surrounding structures and metastasize. That is a cancer by definition. Metastasize means going to distant area from the area of origin. The majority of cancer of the cervix, more than 90%, are caused by human papilloma virus, which is a sexually transmitted infection, highly infectious in the sense that even if one uses a condom, the virus can still be transmitted from one person to the other by a mere fact that the genital area come into contact. Generally, the human papilloma virus is cleared up from the system within a year or 1 year of contracting it, but unfortunately sometimes with recurrent infections, the infection can become persistent, and then it starts affecting the ability of the protein P53, which has the ability to clear abnormal cells from the body of a person, hence the development of cancer of the cervix. The risk factors for cancer of the cervix are mainly related to the human papilloma virus transmission. That means the age at which the person becomes sexually active. If the person is very young, less than 16 years, then the risk of developing CS cervix becomes much higher. If a person is not vaccinated, there is a vaccine against human papilloma virus. If a person is not vaccinated, that risk will also become higher. The use of combined oral contraceptives for 5 years or more increases that risk also. The number of children, parity, if a person has more than 5 kids, that also increases the risk of CS cervix. Smoking and other behavior which may increase the risk in general of cancer. How now can we be able to prevent this cancer? Knowing the risk factors, then we can look at things like primary prevention. Primary prevention is mainly to prevent the transmission of the virus. Having said that, that will mean delaying the age at which a person becomes sexually active. If it delays, as much as you delay it, then the person will not acquire the virus, therefore decreasing the risk of developing cancer of the cervix. Vaccinating people. There is a vaccine against human papilloma virus. It's recommended that that vaccine is given to people of younger age, mainly people who are not yet sexually active. Recommendation is 9 to 14 years of age. Such people should be vaccinated, and that will decrease the risk. There is also a catch-up where they say we can give up to 26 years of age the vaccine. Remembering that a vaccine is not a treatment. It works better when a person has not yet contracted the disease. Secondary prevention is now for people who are already at risk of developing the high-risk patient to be screened. We have the use of pap smear. As we may know, cancer of the cervix, a person does not wake up one day she's fine and the next day she has cancer of the cervix. It takes about 10 to 15 years for the normal cells to become abnormal and eventually develop into cancer. That is a window of opportunity through which we can then screen patients for abnormal cells and deal with them. The screening test is pap smear. There is the conventional method and the liquid-based cytology. The advantage of the liquid-based cytology is that we can also test for human papilloma virus on the same sample. The screening starts from age 21, but ideally it is said from 3 years after a person becomes sexually active. We can use pap smear alone, that is every 3 years, or combine pap smear and human papilloma virus testing. But the human papilloma virus testing, that is recommended from age 35 or 30 every 5 years up to age 60. If a person has been having normal result, then there is no need after the age of 60 to continue with screening. However, here in South Africa, due to the limitation, financial limitation, we are not able to screen in this way. The recommended is that we should start from age 30. Every 10 years, a person should have a pap smear. That means at least 3 pap smear over a lifespan. But there is an opportunistic testing when a person has risk factors present to the clinic. We can still test for a screen for CS cervix, even though they may be younger than 30. Now the treatment. The result of the pap smear. The result comes, there are 2 ways of looking at it. There is the FIGO classification, which looks at it at CIN 1, 2, and 3. 1 being mild, 2 moderate, and 3 severe dysplasia. And the Bethesda classification, which looks at divided into 2 big groups, the low seal and high seal. And those, they can be managed accordingly. When a person develops, unfortunately, during this period has missed and then end up with cancer of the cervix, that also should be dealt with. The presentation of a cancer of the cervix is usually contact bleeding. That means like postcoital bleeding. And when we examine the patient, they bleed, and sometimes they can start having low abdominal pain, abnormal discharge per vagina, and that also can be indicated. Then you examine pars speculum, check if you see a lesion, you biopsy, send to the lab, and then the result will come confirming the cancer of the cervix. After the cancer has been diagnosed, the second stage is staging of the cancer, staging, and that will determine the modality of treatment which should be applied. The earlier the disease, the better the prognosis. It can be cured completely by surgery, but when it's advanced, then it can be just, the aim would be palliative and prolonging life of the person by combining either surgery and chemotherapy, or just chemo radiation, or just chemo radiation on its own without surgery when the disease is advanced. As we may see, cancer of the cervix develop over a long period of time, which gives us an opportunity to can screen. Before that, we can prevent by behavior modification and screen and pick up abnormal cells which can deal with them and diagnose it as early as possible. It can be curable. As we may see, cancer of the cervix is largely preventable, and when it develops and early diagnosed, it can be treated and person can be cured completely. I thank you.